Those of you who don't know, this event is part of a really exciting Inuit event series called Ajuinnata at McGill, which started on September 8th and ends next Tuesday. So this week we have 3 events. This is one of them, and then we have one next week. So we're getting close to the end, and I recognize quite a few of you from previous events, and that really touches me, and I'm grateful that you're here. My name is Anika Anderson. I work at the Office of Indigenous Initiatives, and I'm one of the coordinators of this series. I'm Inuk. I was born and raised in Ottawa, not far from here, and my birth mom comes from Nunavik on Baffin Island, not far from Iqaluit. So I'm really excited to introduce our speakers today, who are going to be speaking about Inuit health and wellness, and they have some questions to guide their conversation, but there'll also be an opportunity to ask you questions maybe at the end or throughout, whatever our speakers decide. So I'm just going to read some quick bios and then I'll let them introduce themselves in their own words. So Minnie Grey was the chief negotiator for the creation of a Nunavik regional government and is the former vice president of the Inuit Circumpolar Council, which is the international Inuit political body. She recently retired from her position as the executive director of the Nunavik Regional Board of Health and Social Services. In her most recent position, she established and furthered health policies in Nunavik with a focus on addressing youth mental health. Richard Budgell, who is a faculty member here at McGill, is an assistant professor in the Department of Family Medicine. Prior to joining family medicine, he was a federal government public servant in First Nations and Inuit health, as well as other Indigenous fields for more than 30 years. He was awarded the Queen Elizabeth II Golden Jubilee Medal in 2002 for exemplary public service in his role in the creation of the Aboriginal Head Start program, which is an early childhood development program for Indigenous children, which I actually attended. So meeting Richard and figuring that out was very, very special because attending Head Start and being immersed in my Inuit culture and surrounded by other Inuit children at such an important time in my life as a young person was really, really impactful. And I think about that often, so I'm very grateful to Richard and all of his work. He is involved in a variety, I keep going, of research projects. Let me find my way here. Including Inuit cultural safety in healthcare and the Inuit community in southern Quebec. So these two lovely speakers have lots to talk about. I'm going to let them get started, and like I said, if you have questions, please don't hesitate to ask them and pick their minds. That's what the series is all about. So thank you, Kuujjuaq, for being here. I'm going to run away.
Thank you, Anika. Nakumik. Anika always makes me proud of my history in Aboriginal Head Start because she's such a fabulous example of how that program can help improve the lives of Inuit and First Nations and Métis kids living in urban centers, and that was the nature of the program that I worked on. And Anika didn't mention this, but her mother was the executive director of one of these great sites that still exists in Ottawa and has been very, very successful. So my pal Minnie and I are gonna talk to each other a little bit as if you weren't even here, but we're going to share this with you. We have known each other for, I think, in 2007. So
the years are a blur since the COVID.
We met when Minnie was one of the co-chief negotiators for Mekivik Corporation of the Nunavik Regional Self-Government Agreement. I was the federal representative. I was the federal negotiator, so that's where we met.
We stayed friends.
and and we stayed friends. And we shared the great pleasure of negotiating that agreement and ending up with what we felt was a very good agreement. That was a first step towards, enhancing governance in Nunavik. It was, however, defeated in a referendum for all Nunavimmiut, and 64% of the people who voted against the agreement. For, I think a combination of reasons there. But we shared in our kind of sadness about the fact that agreement had been disappointed. So we have known each other since then, and in a variety of roles. When I came to Montreal, was working in First Nations Inuit Health Branch. Minnie was by then Executive Director of Nunavik Regional Board of Health and Social Services. So my kind of counterpart in relation to Nunavik, and we talked about funding and work going on in Nunavik. Yep, and Minnie was a fabulous kind of partner and collaborator with us, and I was always pleased and happy to see her either in Montreal or in Kuujjuaq. So, how's retirement so far?
I'm loving it. Yeah. I retired in July of this year. And, but I'm still very busy. My husband jokes that every day it feels like a Saturday. I asked him why. He said, "You're home." So every day is a Saturday. Not really. But I'm enjoying it so far because I still have an opportunity to do things like this. And, for the first time in my career, I don't have to be in a box. I can do things that I want to do. And, already people are asking me to do, if I could do this and if I could do that. And I'm saying, well, I'll think about it and then I can say yes or no. So I say yes to Richard because we're buddies. No, but in areas like health and social services, it's always been my passion. I've been in the health sector for over 20 years. I first became executive director of the Kuujjuaq and Gaba Hospital 31 years ago. And I was there almost nearly 10 years. It was an eye-opener for me as to how all the foreign services that were brought into our communities, how they work and how they should work. It was like an awakening of, well, yes, we don't have doctors, we don't have nurses yet, but we have a lot of Inuit knowledge of how to take care of each other, especially in the area of psychosocial services. So I got to know the doctors and the nurses intimately because it's a small hospital. It was 30 years ago. It was relatively a new building then, with 25 beds, 15 being long-term, 10 being long-term and 15 short-term beds. And it served the 7 communities of the Ngaba Bay. And, it was all an all Inuit board at the time, and it was a great opportunity to look at how can we change things, how can we get away from these services that are coming in with professionals that are coming in that Inuit think are the ones that will solve all the problems. And it took a lot of doing of, no, we're the ones that should be setting the foundation of what we want to see, and these people that are coming in that will leave in 2 years or 5 years should just come and work within our foundation. So that's always been my passion and my philosophy. I went into the regional board after being at the hospital. And I was there for 2 years. It wasn't enough time to really get into things when I was called to be a negotiator for the future self-government. It was for me, that was like, wow, what a great challenge that will be. I like to think I'm a visionary, and I have a lot of vision and thinking of the future. This would open so much doors, and I had already been in 10 years, I'd already seen how public organizations created by the James Bay and Northern Quebec Agreement are in their silos. Here we are in Nunavik. We're not even, I guess we're up to 10,000 now. I think, yeah. Mm. So at that time, it wasn't even 10,000 people in Nunavik. We all, the Nunavik School Board, the Nunavik Regional Government, the Health Board, and McGill Corporation that administers the funds and the James Bay Agreement on behalf of the Inuit, not being a public institution, but these public institutions that are Quebec creatures are all in their silos with their own boards and so on, and serving the same people. And you know, when you're in this, when you're in the health sector, you see a lot of things that people don't see. You see the dysfunctions, you see the children suffering, you see the suicides, you see the trauma and the injuries, and when I was asked to negotiate this future self-government, I grabbed it and I said, wow, this is a time to change things. The James Bay and Northern Quebec Agreement has been functioning with these institutions for nearly 40 years. It's time to change because it's not 1975 anymore. This is year 2000. So the great plan was to amalgamate these three institutions, public institutions, and we thought it was, and we got the blessing from federal government, the Quebec government, and our leaders in Nunavik. But 10 years later, we went to referendum. I'm not going to even try to explain why it was rejected, because we all know in our small worlds of native communities, and we're not any different as Inuit. You know, people will misunderstand things and see them as a threat. Oh, yeah, you know, the negotiating platform was we were doing phase 1, based on the James Bay, what exists in the James Bay and Northern Quebec Agreement. Phase 2, once phase 1 was done and signed off, phase 2 negotiations would continue to gain new powers that were never gained in the James Bay and Northern Quebec Agreement. It was a great plan. It made sense. But, you know, people become very protective of their roles. The school board said, what's going to happen to all our commissioners? What's going to happen to all our councillors at KRG? What's going to happen to the board of the health? Because we eventually wanted to amalgamate them into an assembly, and these institutions would become like government departments. You know, it was a great plan. Mm-hmm. But then again, oh, what's going to happen to our language? What's going to happen to our culture? Is the non-Inuit going to take over everything? These kind of things came into the picture. We all heard it. So here we are, 15 years later, and we're still in the silos. I've worked in my sector within those walls and those limitations. I've done what I could for the health sector with what I think is the right way to go. But now they're talking again about reopening negotiations, but I go, based on what? Where do you start? The start was to amalgamate phase 1, and then if this thing, I really believe that if this project had been approved, we would be far into the future now. And not have to deal, we'd still be dealing with the issues that we have, but we'd be working together under one roof. So that's a long story.
Part of what was interesting, so this is part of where we, I think, really got to know each other much better. We did a tour of all of the communities, all 14 communities, and we did presentations and had discussions with residents in each of the communities. Almost all of that was going was taking place in Inuktitut. We had a marvelous interpreter, and people were able to say, ask very direct questions about what is this agreement about? And of course, that wasn't the first time that people had been hearing about it, not at all. But what I found interesting was there, in the opposition or questioning of that agreement, the naysayers, there was a group saying this doesn't go far enough. It needs to have more protection for Inuit culture and language. That was a perspective. Another perspective was almost the opposite, but still opposed, saying, we're not ready for this. We're not ready for this. We would not be able to manage this. And it would be just another huge opportunity to bring in people from the South who will continue to run everything. But these two really opposing perspectives help then to defeat the agreement, which, I think is regrettable and unfortunate.
I wish them
But
luck.
you
Next
could
phase.
you could get another job.
They already approached me to see if I was interested, and I said, I gave it my best shot. But no, I want to do what I want to do now. It's my time.
I know what you mean.
Yeah.
10 years that you spent at the hospital, so when you finished that, as opposed to when you started, what kind of changes would you say happened in that period of time?
That was a long time ago. You're asking me to remember things. Okay. Yeah, I came in very green. I'd never thought I would run a hospital, because I'd just been having positions of elected positions, vice president at McGill Corporation, council member for Canada for ICC. So I was always in these, elected roles. So, I had children, and I was always leaving them at home and traveling. So I decided that when I didn't run again for Makivik, I decided that I would like to go back to Nunavik, because I did live here for about 10 years, and at the time. So I applied for the position. People contacted me and said, look, because there was always a non-Inuk, somebody from Quebec City that was a DG, they called it Director General of the hospital, and they supposedly had an Inuit board. Well, they had an Inuit board, but the Inuit board wasn't engaged in it because there was no collaboration or partnership with the Southern DG. And they started to really speak up, and they got rid of their DG, and one of them contacted me and said, would you be willing? I hear you're no longer elected, you're on your own now. And I applied. I applied for that position, and I became the first Inuk woman to run that hospital. I did it for 10 years. It was, like I said, a learning experience. I learned all about what a nursing director does, what the DSP does, and the CMDP, and the pharmacists, and anything about a hospital. I learned on the job. But I think it was more like the interaction that was created between all those Southern professionals and a young Inuit woman that came and started connecting to the communities. And I think that was the start of a change, because the hospital was no longer a foreign place. Right. I see a face. It was no longer a foreign Nunavik. And that's another thing that to this day I'm trying to change mindsets and the vocabulary, the terminology. Nunavik is a hospital, a place to be sick. Yep. Because that's when Inuit were sick, the hospital was a place to go. So they called it the place to be sick. So to this day I'm trying to say, can we stop it calling it Nunavik in our language, can we call it the place to get better? So in my years now, since the recent years, we're starting to build new CLSCs and nursing, the clinics in the communities. And I've proposed that we call them Akitauvik, a place to get better, a place to heal. So things like that. So from that time to the time I left, I think the culture of the hospital that I entered totally changed to become, oh, we're part of this community. And another thing that changed was, I mean, there was a lot of focus only on curative. Let's cure them, instead of let's prevent. So all that started to become, and the board of directors were there because they had an executive director that would work with the non-Inuit and be a liaison between what they thought should be done in their hospital. So I think that's what happened. Yeah.
You're talking about use of language, for example. So, so I'm involved with a group of people here in Montreal that are working towards setting up some kind of Inuit health center here in the city. So we've just come up with a name for it, which is Havivik. So
Havivik.
Havivik.
Yeah.
Yep. Havivik.
A place to step up, or yes, yeah.
That's right.
Havivik. Yeah. Double V is V. And just an Inuit lesson for.
Since I've been teaching, for example, and you know I'm not an Inuit speaker by any means at all, I am more aware than I was about the importance of language and about the importance of using Inuktitut to describe what we're doing, to describe health, to describe places where you would go for health. And like the use of language, I think, is pretty central in that, because it's a foundation and a way of describing things, and it decolonizes.
And language is really key because, as I said, Nunavik versus Nunavik. Nunavik is so negative, and Nunavik is positive. And in the recent years, since I've been at the helm of the Nunavik Regional Board of Health and Social Services, we've created a lot of programs to address mental health, mental well-being, and we've named all those programs in Inuktitut. You know, if we didn't use our language, like for example, Nunami program means on the land. Being out on the land as an Inuk is a healing, way of healing, and for bringing together families, and to do activities culturally and traditionally, and using our language. Another program, and these are all programs I'm really proud of because, you know, I was there for their creation. And Sakiyuk means a change in wind direction. And this program addresses the addiction, the alcohol abuse addiction, which brings on people, you know, because of their addiction, they get into breaking the law. And, you know, instead of having a place to go except jail, and they go to court and they become criminals, and, you know, these people would not normally be considered criminals, but they have they need help with their addiction. So we created a program called Sakiyuk, the change of wind direction, in which mostly young men are taken under this program. They're made to work with the groups of people, building sleds, building garages for skidoo repair. They go out on the land and hunt for the community, like that. And this program also has had the social services and the police working together so that they tour the community, not in a police car, but in the Sakhiyuk car. If there's ever a call, if the police receive a call of disturbance due to alcohol, these two people, a police officer and a social worker, go check it out instead of the police going there and arresting this person and putting him in jail. These kind of things that people understand and that they feel secure in, and they don't get scared. They don't have fear of the next steps that they have to take.
Is it men only?
No. It's and everybody, and includes the family when it comes to. And then following that, we also created the Nitsik program, which is a wellness court instead of a criminal court. So these people that the Sakhiyuk people bring, they are given a choice. Okay, would you like to go to the wellness court to see a different judge besides the criminal? And then right away they'll say, no, I don't want to go to the criminal court, I'll go to the wellness court. So they're given options by the judge. And would you like to go to treatment? Would you like to go to Sakhiyuk program? And a lot of them take Sakhiyuk, and a lot of them go to treatment. So it's starting to work, things like that. And something else, the pain of many families is the Youth Protection Act, which removes many children. Every meeting we would be at, youth protection this, youth protection that, poor children being removed. But at the same point, the children need protecting, because they are in danger, many of them. So we took on a vision of there's already a section in the Youth Protection Act, 37.5, that allows Aboriginal communities to take on the role of protecting their children by amending the law and setting a program for themselves in their community. So that's what we're doing too. And we're calling this program Nunavik Ilagi Papatavinga, which is the Nunavik Integrated Family Program. Little things like that. It's and family houses in the communities. These are all things that the Southern Services would never have thought of, but we do, because we have to find innovative ways, culturally safe ways, to provide services that people will feel safe using, and not be afraid to go and say, I want help through your program. Because many families struggle, and a lot of them will go, okay, where do I go? Who do I call? Especially in the area of mental health, mental wellness and illness. So
the foreignness of a lot of the system has been another striking thing in relation to Nunavik for me. As the history in Labrador, not really the same kind of thing, and much longer contact also with Euro institutions, that kind of thing. But to move in a direction of making systems less foreign and sort of taking on an Inuit kind of ownership and direction, that's
very important.
Seems fundamentally important.
Yes, it is.
So that people see the system as belonging to them.
Yes.
And that they can have some control of it as well.
During the 2 years of the pandemic, Nunami program was very popular because, we couldn't visit, we couldn't see family members, but people were allowed to go on the land within their own families. And, it's very costly to go out, your snowmobile, gas, equipment, food. So because people couldn't congregate, different people. Normally, Nunavik program is designed to have different members of the community, whether you're elder or youth, to be able to go out on outings and teach and have counseling. But we couldn't even do that. No, not even outside if it wasn't your own family, because you have to go in a tent or a cabin somewhere, and if you're not from the same household, you can't be in the same space. So it brought families together. It brought people were saying, it's terrible that we're suffering from this terrible pandemic, but it's brought families together, and it's Nunami program, like programs like Nunami with the funds that are being given for food supplies and gas. So it became well known. I mean, they would ask, in the beginning, people would ask, what's Nunami? So we would have to always promote it and talk about it. But during the pandemic, Nunami was the word. Yeah.
That's good. It's excellent.
Yeah.
It's beautiful.
You've been replaced now at the health board.
Yes.
So in that period of time, I guess it's my same kind of question, from when you started there to when you ended. What are you most proud of? What are you happiest about in terms of changes that happened in your time at the board?
Well, I came into the board nearly 10 years ago after living here and after our attempt at creating a government. I came into a dysfunctional organization, and I'm extremely proud that I built it back up. I built up a team. I got great respect from the people that I worked with. I also, I think, developed a very good collaboration and partnership with my fellow silos, the same silos that I disliked so much, but you can't dislike the people within those silos. So I think I made really great connections, and I think, and I'm going back to the pandemic. The pandemic was a big thing all over the world. But in our small communities, in our small region, somebody had to lead. Somebody had to lead, and it was the health sector. And I was the voice of that pandemic. I was the voice to the people of Nunavik. And it was a very, very hard, challenging job. But I did it with my team, and I'm extremely proud of that. I always thought, oh, well, maybe I don't really want to retire right away. But after the 2 years, I said, okay, I think I've done my part. I think I've given Nunavik what I think I can. So I decided after the pandemic that after my birthday, I decided, okay, I'll retire. But I just finished telling you about some of these initiatives, the grassroots initiatives, programs for Inuit by Inuit. Mm-hmm. I think that's something I'm very, very proud of. That I touched upon Nunami and Sahiyuk and the Youth Protection Act to be changed, and the setup of family houses to help communities and families to learn to care for one another, and the partnerships and the links that I've, and yourself, we, after we parted from the self-government project, you and I linked back again. You were at Indigenous Service Canada. I was up there, and, we used to have this year-to-year funding program in which, okay, if you had a penny left over, we had to send it back to Ottawa. And with Richard and I and our connection, we ended up doing a 10-year agreement in which now the health board has a 10-year agreement with Indigenous Services Canada with different programs such as home care, et cetera, et cetera. And we don't have to, well, we're still reporting, yes, that's how we do it, but I don't have to send $500,000 a year. I mean, I'm still saying we don't have to send $500,000 a year back to Ottawa if we didn't use it from a certain program, This thing. Yeah, that thing and that thing. But now we have this 10-year program where and it was really hard with the COVID because we couldn't spend that money. you know. So it's a good thing that we have this 10-year window, and we put aside for our own use and then transfer it on to the next year. So these are the kind of things I think we were good at.
I was part of that too.
Yes. Yeah. Oh, yeah. And do you know how we managed this? We convinced the Quebec government that this clause doesn't work for us. What was yeah. What number was that? I can't remember.
30.
No, 98. No. Oh, well, we can't remember. But there was a number clause in the federal and provincial funding transfer.
The provincial government has to permit federal funding going into a Quebec institution, which the Nunavik Regional Health Board is. It's a Quebec
We fought
institution.
that law.
Yeah.
Yes, and we won.
I mean, like, this stuff sounds administrative.
Yeah, but it's a battle.
It's fundamentally important, though, because what the 10-year funding agreement essentially gave the health board much greater control and even a form of sovereignty over the federal funding. The federal funding is only what percent? Under 10%.
Well, yeah. Under the JCR Northern Quebec Agreement funding regime, feds is 25 and 75 Quebec.
Education.
Yeah, but basically out of our whole budget, it's only about 10%. Yeah.
But it can kind of be leveraged. I mean, I think the board did that, and the board really leveraged that contribution. And it's a multi-billion-dollar contribution. So it's not peanuts. It's kind of helpful in all kinds of ways, especially if the board has that kind of control to roll over funding and spend funding, move funding around within.
Yeah, it certainly has taken use of that funding for things like suicide prevention strategies and mental health. Nunami is partly funded by that. Yeah.
Should we throw it open to you guys? We're chatting away quite happily here, but if there were...
We're reminiscing.
If there were questions from you guys, we would welcome them. Gwen?
I have a question about healthcare being taken in Nunavik rather than here. And it's based on an experience I had in 2008 when I stupidly stepped off an ice rink and broke my wrist. But you go back to the hospital a bunch of times to get your everything checked, and I met like a 15-year-old girl who was there and miserable because she was stuck in Montreal for whatever needed to be done. And I kept thinking, wow, she's so far from home, she's young. And that I didn't feel like people were, no one was telling me I was stupid on how I hurt my wrist, but people were telling her she was sort of stupid, which was bad. But I thought about that in terms of hospitals. Is there expansion enough so that fewer people have to come here and go through a bunch of treatments here that are from family?
So about extent of care, healthcare available in Nunavik versus what people have to come here
You can read about it in the Montreal Gazette, because during my interview on my way here in the cab, I talked about that. You're very right when you say, if we had, I said our hospitals, whatever, the little hospitals, the two that we have in the region, one in Puvirnitik on the Hudson Coast and one in Kuujjuaq, they're very small. They don't do emergencies, they don't do trauma, they don't do surgeries. They receive specialists that come up and see people, and those specialists see the ones that have to have follow-up here. So we have the lodging facility in Dorval called Ullivik, where it's always full, and the overflow goes to the hotels, and the only places that people can see specialists or get the special care that they need is here at the
MUHC usually.
the Montreal General and the Glen, and that's just the way it is. It's if you break your ankle, if you break, I once broke my wrist. They can do tasks, but if you seriously injure yourself, there's no way they can fix it up there. The Challenger is always busy. The Challenger is the Quebec government hospital at Plain. It's constantly going to Nunavik because it has to transport patients here. Our airlines, they're used for medevacing people. It's just reality. So one of the things that in your question that I forgot to answer, that I didn't answer, is that when I came back into the health board, I decided that it's time that Nunavik needs a regional hospital instead of these two small hospitals with their 25 beds. So in the last nearly 10 years, I've been working, pushing the Quebec government, which I think has changed twice or three times now since I've been in my position. And believe me, I mean, having to teach who's in power, Nunavik 101 is another aspect of your job. And so finally, we are now in the process of having our clinical plan approved by the government. We'll see how long CAC takes to go back to their files now that they're back in power, and then once they approve the clinical plan, there's the functional technical plan, which will be how the hospital will be designed, and then maybe 5-7 years we'll have a regional hospital. That's the thing, and then. Even if we did find a location, a best location for it, then the politics of Nunavik come in and say, why is it always in that place? Why wasn't it built here? So, so this is our reality. But I'm glad to know that finally I convinced the Quebec government that Nunavik needs a regional hospital. They would save so much money because the regional hospital would be able to care for all those people that have to be medevaced unnecessarily. Yes, the heart patients, the cancer patients, the trauma patients are still going to continue, but why are you sending people for ophthalmology? Right. It's like, it doesn't make sense. And Nunavik, who's costing a lot of money because it's overcrowded, there's hotel rooms being rented, because there's many people being sent down. It doesn't make sense. So I've tried to convince the governments that are in power, this is an investment for you. Well, you say that. And most importantly is people get treated in their region, at home, or close to home, and don't have to be in the dangers of the South. Recently, in the last few months, we've lost 3 Inuit patients in Montreal because of car accidents and stuff. That wouldn't happen if the regional hospital was in Kuujjuaq or POV. They would be living with their fellow Inuit. Sorry.
I'd like to follow up Gwen's question, because for example, the 2 young mothers who were killed on the highway near Nunavik in the middle of the night, 2 o'clock and 5 o'clock or something. And 2 days later, we heard nothing. In other words, it didn't stay in the news. Nobody followed up. One of the mothers had 2 children, the other had 3. We never knew anything about how the families coped. And we didn't know how it was those women needed to be out there at that time. Now, everybody has their personal lives and things they want to do. But if there was a way for people to be comfortable in Nunavik, would they be trying to get out to other places? Or I'm just wondering what else can we do at Nunavik that would make things more safer? Because I have a whole lot of questions. I'm going to ask one more before I let you answer. I don't know how many staff, Inuktitut speaking staff, are hired at Nunavik, but I hear about Inuktitut speaking elders who have to come down and they look at the food and they have no idea what the food is, and they have no idea how to ask anybody about the food. So how can we help with that? Because food is medicine.
When you say how can we help with that, who's we?
Everybody.
Oh, well, I asked the same question because I've been dealing with the Nunavik issue for nearly 8 years as the executive director. Nunavik is managed by one of the hospitals in Nunavik, which is the Inuit Civic Hospital in POV. I have been trying to change that to have the management move to the regional board because the hospital in POV has its own mandate, and taking care of a regional service like that, it hasn't worked at the distance. And I ask the same questions as you. How can we improve Nunavik? How can we help it to improve? It has very dedicated people working there. Mm-hmm. And, there's always a bad apple here and there, but they're very dedicated people. Unfortunately, it has rules that sometimes people just don't want to follow. It has rules. It's a place for people to stay away from, a place to be like a home away from home, people that are here for medical reasons. And the elders you're talking about, an elder will never be sent here without an escort. But maybe that escort is neglecting that elder. You see, there's another side to the coin. And if you're down here for medical reasons and just partaking in things that you're not supposed to, well, the guards you have rules. You're not allowed to frequent. You can't be in Nunavik. So you have to find a place to stay, or there'll be a room where you're put in. I mean, it's all set up. And the issue of food, it's always being discussed. Unfortunately, the 80% and the 20% thing concept works here. The 80% are okay, but the 20% make it worse, kind of thing. And I'm very, very sad to talk about those two women. There was another one following that was downtown here. We don't know why they were out, especially one that was in a wheelchair out on a highway. Why? Why? When you have a nice place to stay in Nunavik. But sometimes there are people that are targeting them. Yes. I'm sorry to say, when we moved Inuit from the downtown YMCA and picked a spot in Dorval, we thought that was the greatest thing that was going to happen and be the best solution. But I'm sorry, whoever was here followed and are targeting Inuit once again over there. And we created a program with the police there when Nunavik was new, where a police officer would come in and we made a video for people to watch for the dangers and be careful of this, and you could be victimized, and these are all in place. But we cannot control everybody and their habits, and that's just
as a point of comparison, the Nunatsiavut government in Labrador, the Labrador Inuit government, Same comparable kinds of situations where people are flown. There's no hospital in Nunavik. There's in Goose Bay, but not in Nunavik. So people are medically transported either to Goose Bay, but most often to St. John's for any kind of complex care. People go to St. John's, same kind of distance as from Kuujjuaq to here. There is no residence in St. John's of any kind. And Nunavik was an improvement over the YMCA, right?
Yeah.
The Friendship Center in St. John's is now in the process of working with partners to construct a residence in St. John's that would be kind of the Nunavik model. I mean, part of the positive side of Nunavik is, it has been managed by Inuit institutions and entities, right? So, it's not a, outside kind of organization.
Distance though, right? I mean,
Well, I think the reason for that was its proximity to the airport, partly, also, right? So,
And
sorry.
the distance of transportation?
No, I mean the manager, the people in the, I don't have a say.
but they have Inuit working in Nunavik. They have all the interpreters working there. They had an awesome Inuit manager that Nunavik got rid of, and now they're in the process of hiring a new director. Who from what I've heard, there's someone applying, which I think will make some changes.
And what about the staff in the cafeteria?
Oh, from the last I've heard, they were looking into changing some of that.
The contract is over, I understand, and they're gonna do something else.
So,
Don't forget that we also have a little kitchenette where Inuit bring their food. There's a freezer. They can cook their own meals, caribou, fish, whatever is there. Yeah.
Marianne?
Yeah, as far as I know, one of the most pressing health concerns in Nunavik is suicides. And I'm wondering if you have come up with a strategy, if there's hope, how you feel about the situation. I'd love to hear you speak about it.
Thank you. There's always hope. Yes.
Thank you, Minnie.
The Inuit Taparit Kanatami developed their national Inuit suicide prevention strategy. Following that, Nunavik, we decided that we would work on ours in conjunction to work with the national one. We developed it with all our partners. We have in place at the health board the Regional Suicide Prevention Committee that met regularly, from partners from all over. The two hospitals are represented, the police are represented, anybody who is represented. And they worked really hard for over a couple of years to develop this really, really comprehensive Nunavik suicide prevention strategy. It went to the partnership committee and it was approved. It went to the boards of the hospitals and our board, and it was approved. It was a really good strategy. Everybody agreed on it. All the partners agreed to work on it, and the action plan was being developed. All the partners were asked to develop an action from their perspective, from their mandates, as to how they would contribute to the strategy. And then COVID hit after the first meeting. So now it's being reactivated again. It's really, I'm really happy to know that it's being activated again. We have a great woman there in leading to get all the partners organized again and livening things up about, okay, yes, we have suicide. I'll just talk about one organization that is a partner and worked on their program, and they're calling it the kindness program. So they're promoting kindness amongst all their it's a housing board, regional housing bureau. They're calling their program the kindness program. Show kindness and to motivate people. Little acts like that, but. I'm also very glad to hear that there's a Greenlandic Inuit psychologist. Her name is Ajuinnata. She will be coming to Kuujjuaq in January with ICC. I'm on the Inuit Circumpolar Council, Inuit Steering Health Committee, so I'm very linked with the mental health work internationally also under ICC. So ICC hired this moderator because we're linking with ICC, but the health board person that's leading the strategy implementation contacted ICC and was referred to this wonderful moderator that we work with at the ICC level. He's going to come and assist in the looking at the strategy, what next steps to do, how to implement it, how to engage the partners. And we've invited, I keep saying we, that Ajuinnata has been invited to help and do workshops in Nunavik and Kuujjuaq. And another thing, speaking of language, we had the meeting when we had the meeting to approve the strategy. We didn't want to call it the new Nunavik Suicide Prevention Strategy. We wanted to give it an Inuit name. So I proposed the word Inuguminak. Inuguminak. Yeah. Anyways, people proposed words in a meeting. It's a regional partnership meeting. Inuguminak means the wish to live. Yeah.
That's beautiful.
Yeah. Yeah.
That's beautiful.
Yeah. So. Joe, did I answer your question?
Yes, the kindness program, is it administered by the health board?
No. It's the partners, the organization. Sorry, we ask our partners that are part of the committee to do their part. You can't just ask the health board to do everything. Do your part. And that's one of the things my message was always as the executive director of the health board. You can't just expect us to do everything. Do your part. Especially during COVID.
Has it started? Is it going? The kindness program?
Yeah, the kindness program is going. Yeah.
What do you?
When you stepped
Go
down
ahead.
as the executive director and having replaced someone from the south, was your successor from your community? In other words, the Quebec government didn't then throw someone.
Oh no, my replacement is Inu, and she's a young lady. She's the same age as I was when I took over the hospital. And I'm mentoring her and supporting her.
And she's going to get gray hair.
Yeah, well, she's already complaining about starting getting gray hair.
It happens.
So you're not
For some.
you're in an official mentor capacity with her?
Yes, yeah.
That's really nice.
Yeah.
It's not something that everybody gets to.
No, I committed myself to mentor and support her at least for a year. Yeah.
That's nice.
I mean, you don't ask someone to just jump into this kind of job, and it's like asking them to fail. Yeah.
Actually, that happens a fair bit.
Oh, well. Not,
In my career, anyway.
Not on my watch.
What do you think is? Oh,
There's
sorry.
people.
Yeah. Go ahead. Sure.
She was first.
Oh, okay.
Thank you for all these. One thing we know around making things more culturally safe would be to have more Inuit being
In the,
living in cities.
yeah.
And that has been for me a question always, like how do we get Inuit to take decisions?
Yeah.
And I know there are some programs, like the midwives program has been great, the one in daycare with training people in Nunavik, so help like young women with families to be part of the working force. And I know there's, again, I think a program developed for social services together with McGill. I'm wondering about more the medical, what would be the strategies at this point to have, I know they're long steps, like we have to help the young ones to finish high school, to come here and feel secure enough to come to Montreal to continue, but what are your ideas around improving that aspect of the...
Very good question. Pardon?
Can I ask that question?
Yeah.
Do you have a number of Inuit doctors and medical providers?
That's a very good question. We don't have doctors. We've had a number of, we have had a few Inuit nurses, but they've all retired and gone somewhere else. And that's a really good question because I, for one, really want to see Inuit in those workforces. It's even hard now to even have Inuit social workers. Especially in the area of youth protection, because you know, there's your cousin, there's your aunt, there's your brother, you know. So, but we really do need medical Inuit in the medical field. But we're not seeing the young people getting into. There's a few. I know there's a young woman that's graduated recently, and I really believe in promotion of that. Actually, finally, we've. After working many years, trying to work with the school board many years on developing some programs, they're starting a pre-nursing course this fall, I think, and to move forward and hopefully a full-fledged nursing course. But really, this is the same question we ask. We wish we could get to get the young people interested in the medical field, but I think medical or the hospital or the health sector is kind of intimidating to people because, as I said, even in social work or the youth protection, you're too close to everybody. There's no filter around. But hopefully that will change, and I'm very optimistic. One other thing that we're trying very hard, and you also, hopefully it'll be in the Gazette tomorrow, because I want it to be, is the Inuit working conditions. In the health sector, the other organizations offer very competitive working conditions to their Inuit workers, much like their non-Inuit. In the health sector, according to the Ministry of Health of Quebec, we're not allowed to give working conditions same as people from outside because the Inuit are already living there. The ones that deserve it are the ones that come in because they're going to a very remote place. Right. And I've argued against that. The far very remote place was in the 60s. Now we're in 2022. We're not, just pick up your thing and you're not far. You can talk to your mother, you know? So this whole mentality of the government saying, oh, the ones that deserve the working conditions are the ones from the south because they're very far from home. So I've been arguing, and I've gone to the Viens Commission to say, and recommendation 107, I think, of the Viens Commission says the Inuit have to get their working conditions just like the southern people. So that's another thing. In our sector, we're not attracting Inuit. Yeah.
Because of this disequilibrium.
Yes, yeah.
In terms
so
of how people
the school board finally got their Inuit working conditions. So I asked the ministry soon after that, I said, "So what's wrong with it? What about us? What about us? You give the." I spoke to not our ministry, but one of the ministers, that you gave that to an institution much like us. What's wrong with us? You know. So
Is it collective agreement stuff?
no, it's not. Yeah, it's related to collective agreement. But then again, hopefully things will change, because I know that this fall is very hot. Yeah, at the ministry. Yeah.
There's a question further back.
No matter who they are, they want to go there.
Pardon?
And if you pay people well, and you pay them
Yeah.
the same as everyone else, you're going to get the people to go there.
Yeah.
You're going to get people living there wanting.
Yes,
to have those
yes,
jobs and
yes.
be able to live
And
out.
that's another thing. In the years that I've been at the health board, I've brought in a lot of young Inuit, and I'm very proud of that too. Yeah, yeah, yeah.
Yeah, well, my question was pretty much answered.
Oh, okay.
I was wondering about that, about, yeah, your perspective of where things are going with young people.
Yeah.
in Leadership jobs in the health sector. And you talked about sort of a silo thing going on, and I was wondering if there were collaborations between the health board and KI to, develop programs for training for.
Well, there's more and more collaboration now, much better than in the past. I don't know. Leaders change. Like myself and the executive director of the school board, we've known each other for many years. We have our teams, and if we can collaborate, our teams can collaborate. Yeah. Slowly, hopefully, the silos crumble.
Richard, why don't you talk a little bit about what you're doing here?
Yeah.
That relates to what, in terms of sensitizing people, making them aware? Because I think the question was, what's McGill doing? I think is.
Well, that's a very good question. What's McGill doing?
Since you've been here, I've heard good things. Yeah.
I think something that we have in common is I think we're both fundamentally pretty optimistic people, and I think that's characteristic of a lot of Inuit, frankly. Just this Ajuinnata, being able to manage and move forward. So here's the bad statistic. We do not have any Inuit trainees, medical trainees at the moment. There's 7 or 8 First Nations trainees, which is typical. They're seats, designated, paid for by the Quebec government. So, it's always nice to see some, Indigenous trainees coming in. It's wonderful.
Do those seats that are saved include space for Inuit?
They're not designated, but they would absolutely qualify. Yep. But people have to apply, and people have to qualify. That hasn't been happening. So
Is anybody applying and not qualifying, or is it they don't
Not-
qualify, they're not applying?
I think not applying.
Just not
I think not applying. Part of what we're trying to do in family medicine is at least create an environment where people will feel very welcome. So we just inaugurated this space in September, an Indigenous space within the Department of Family Medicine that I made quite sure also had Inuit art in the space, and with collaboration of people here. So that it sends that kind of signal to say this also includes Inuit. And there's been great kind of support for that. I started teaching last winter in January what is the first course at McGill on Inuit health. So it's a 1-credit graduate course on Inuit health. It's apparently the first of its kind in Canada. I have not seen another course of its kind in Canada. And it's really useful pedagogically, I think. And it gives a forum where I can have people like Dr. Gray come in and guest lecture in that course and talk about, her vast experience in this field. So, it's sending a kind of a symbolic kind of signal, but also there's substantive stuff going on there. So, I'm optimistic that we, creating this kind of environment could help us, attract applicants. And I mean, one of the things that is happening within the Inuit population in Canada, the proportion of people living outside of Inuit Nunangat has increased substantially from 2016 to 2021 censuses, from 25% to 34% of Inuit population now living outside of Inuit Nunangat. So that also means people are living in places like this and getting their educations here. So it may be that the barriers are a bit less if you're already growing up in a place like this. So, we'll see. This is a long game.
Yeah.
We're playing the long game here. This is not an instantaneous kind of solution that will fix everything, but I think lots of us and lots of people younger than us are up for this and want to make this kind of change. Yeah.
Yeah, thanks. If I may, I'm an AT instructor at Dawson College. I'm doing my doctoral studies now with Indigenous educational sovereignty, and I run a project called the First Peoples Post-Secondary Storytelling Exchange. So we heard from many students learning post-secondary Inuit First Nations and Métis their experiences. And one of the outcomes was that, and it's nothing new, but obviously call for post-secondary opportunities in Nunavik, in USG, and in communities where the students are coming from.
Yep.
So some students spoke specifically about wanting to do math and sciences and not having those opportunities to do those high-level courses at home. But also when you do come to college, the curriculum and the approach to the education is a way that maybe not be conducive to all learners. So just one thing that's really exciting is I'm hearing that the KI now is looking at developing college studies in Nunavik. I know there are different initiatives, the certificates and whatnot, but it's exciting because there are such barriers to achieving the college degrees to be able to go into university in Quebec anyway. So it's exciting, I think, to be able to create those pathways, and because I've seen the interest, and many students do come down to our colleges and want to do
That's great news. That's such great news, because they'll come out with their high school, come down to Dawson or whichever, and they'll go, I don't belong here.
Right.
I don't know anything. And I mean, it's such a a blow to a young person that was so proud to graduate and then come down here and know that they don't have the right credentials to do this program, and they have to do 2 years of social studies, and it's and this is something that Nunavik have been asking for a long time. Can we have college courses in Nunavik? So that's nice to hear.
In Labrador, the Memorial University is now in the process of establishing a campus in Labrador. Labrador is a bigger population than Nunavik, but the circumstances are comparable in lots of ways. And I mean, I think to make education, post-secondary, like Cégep level, for example, more accessible in Nunavik, reduces the barrier. And that's what we should be thinking about, how to reduce barriers that are unfair, that people shouldn't have to live with.
Is there an early outreach education plan?
Pardon me?
An early outreach education plan to work with the Inuit so they don't have to do a victory lap when they get here, do an extra year of college or extra year of high school. Is there an early outreach plan to work with the Inuit youth to get them to McGill or a place like McGill?
So something that does exist in Nunavut and Nunavik is Nunavik Sivuniksavut, which is a qualifying
Yeah.
year.
Yeah, a qualifying year to go into CESHAP. Yeah.
Yeah.
And what about a bridging or early outreach program to attract Inuit students to the medical program? Is there anything in that one?
There's not an approach here anyway specific to Inuit. And in fact, that might be something worth contemplating.
What you're trying to say is that even though there's an Indigenous, there's seats for Indigenous, which umbrellas to Inuit, it's not attracting to Inuit, is what you're saying. So it sounds to me like you're also saying, this is how I'm hearing it, that there has to be something that focuses on the Inuit youth.
Yeah, Inuit aren't implying at least, so yeah.
So I think there needs to be a discussion on early
Yeah.
Well, there's been committees put together under the Faculty of Medicine in which I've been part of, other Inuit have been part of, longtime doctor that have been in Nunavik for over 25 years have been part of. And we work with the doctor,
Stewart?
Sailor?
yes, yes.
Ken Sailor.
Ken Sailor, his group, you know, we've tried to include Inuit. Like you say, they're not applying.
Are there any Inuit doctors anywhere in Canada?
Oh, yeah. Oh, yeah.
There's a
Yeah.
young lady who became the first Inuit cardiologist.
Yes, from
She's
Nunavik.
been on
Yeah, yeah.
There's some family doctors as well.
And my cousin, who I'm having dinner with on Friday night. So, who's been a family physician for 30 years. Like we're close in age. She practices in New Brunswick.
But when they have a hospital up there, there's no reason for, they don't have a practice.
Well, you have to have a hospital generally for a family physician to be affiliated with. But I mean, like, I don't think that's the biggest. I don't think that's the biggest impediment, because you can have somebody practicing here and in Nunavik, for example. So there are ways of figuring things out. Anyway.
Cheap suggestion, posters in Nunavik, so that every kid who comes down with a broken leg from having played hockey sees, well, I never thought of being a doctor. Well, or she played soccer and got a concussion and she's down here being evaluated and she's here, she's at Nunavik for a while maybe. If we had some way, if that's our only place where we've got people for a while, sometimes it's 4 days, I realize, and sometimes it's 4 weeks.
Mm-hmm.
Could we use that residence as a source of information for the North?
I don't know. I know they, tried. They tried to have activities for the people who were there, especially longer term, so that there's things happening that are appealing and of interest to people who were staying there.
They tried and it didn't succeed, or they are.
No, I think it's probably an ongoing kind of thing. Yeah. Mm.
There is an initiative with up north with a doctor in particular that she brings youth in the clinic in different villages to show them the different professions.
Yeah.
So there's a few, I think there's a few initiatives.
Yeah, there are. There's also the
long road.
Right.
there's also the program where the schools and the organizations promote to stay in school program.
Mm-hmm.
Yeah.
I saw a hand up in the back, and I'm thinking we should maybe do one, maybe two more questions and wrap it up and thank Minnie and everybody. Yes. Hi.
I just wanted to give a shout out to Minnie and to Richard. So Minnie, one of the most amazing things that you've done within social work, I mean, there's so much, but as you were seeing, you know, your transition, what you did to put in place the program that social work will now, our McGill's BSW, we're going to deliver it in Nunavik. Is just incredible, and I just want to applaud you and thank you for doing that. It's an amazing initiative. And,
Thank you.
it really took persistence and patience. And Richard, thank you for helping us to secure funding from the Quebec government for this initiative. And I just wanted to say one thing when we look like what we can do, myself as a non-Indigenous person. I'm a professor in the School of Social Work, and I have privilege in this institution. And it's really about kind of harnessing that and seeing like what role we can play to you know, towards decolonization. And I work with Michelle Smith, and just the excitement that people have with McGill coming to Nunavik to deliver courses. And it's the same curriculum, but tailored with the two Inuit social workers. It's just amazing. So thank you for leaving that legacy for us.
So perhaps we should wrap it up.
Yeah, I think so.
I want to say nakamik to my pal forever. Our collaboration will continue.
Yes.
I have no doubt of that. And I know that you will continue to contribute in all kinds of ways. I'm just so proud and honored and delighted to have you as my friend. It's a great privilege for me.
Me too.
Thank
you.
Nakamik.
Yes.
Thank you, everybody. Thanks, guys.